As he mentioned, we moved here from Missouri and in April, and started in May practicing here in town. And then as of September the 1st, we are proud to say, Jamie and I have opened up our own clinic, and it is across the street from Community Health. We're across the street from Showboat Assisted Living. And the owners, the Dr. Barnes, the pediatrician, said, just tell everybody you're in Dr. Jones's old office. And so we are right next door to Community Health Pediatrics. And really excited to be there, and we're just kind of getting everything up and running, and pretty much moved in. We got a few pictures on the wall, but we're making progress. And the name of our clinic is Aspen Glow Obstetrics and Gynecology, and we hope to get our sign up this weekend. So if any of you are looking for something to do, Saturday morning, we may be doing a little carpentry work out on the lawn. But anyway, we are proud to say that we're now residents of Wyoming and glad to be here. You can see some of our propaganda on your tables there and our phone number. We are also on Facebook. We are on the web. So if you do a search for Dr. Ken Holt or Aspen Glow Obstetrics and Gynecology, you should be in Lander. You should be able to find either one of those, including an article that we just recently posted on Facebook about today's subject, Polycystic Ovarian Syndrome, or PCOS. How many in here have ever heard of that term? So a few hands going up, so that's good. To elaborate on why we decided to talk about PCOS today is, this is PCOS month, and everybody's tired of talking about COVID. So we decided to find something different. September the 1st was actually PCOS Day. And the reason that sometimes disease processes like this reach a degree of importance and forefront of the news and what have you is due to the lack of understanding and attention that this condition has generated in the past. So PCOS is one of the most critically underserved and underdiagnosed and underfunded conditions affecting women's health. And since women's health is what we're all about, we felt like today would be a chance to share with you a little bit of information in regards to that disease process, the symptoms of it, how to diagnose it, how to treat it, and where the future hopefully will take us. So bear with me, and we'll keep this relatively brief. You know, it's after lunch. Everybody had chicken and gravy, and lunch was great, thank you. So we don't want you dozing off back there. PCOS awareness is important to help patients overcome the symptoms and the presentation of this disease. The disease process has the potential for life-threatening related illnesses such as diabetes, cardiovascular disease, as we see alterations that take place due to the change in the hormonal milieu. Additionally, it's thought to potentially have an underlying influence in increasing the risk of endometrial cancer. And we'll talk a little bit more about that as we go along. The history of polycystic ovarian syndrome, or PCOS, as it's commonly referred to as, is known as the silent epidemic, affecting some 100 million women worldwide. Rotary International, being a worldwide organization, certainly has the potential to share some of the news as well. PCOS is the most common endocrine disorder causing anovulation, or on a monthly basis when a woman should ovulate, not ovulating because, again, the changes in the hormones that take place. It's responsible for 85% of infertility issues associated with the failure to ovulate. PCOS can lead to lifelong complications as well as life-threatening diseases, as we previously mentioned, type 2 diabetes, cardiovascular disease. We see insulin resistance, where the insulin that your body makes is no longer working very well, so the blood glucose levels do not come down in response to the insulin. And so individuals are walking around with elevated levels of glucose, and which has a negative impact on kidney function, blood vessels, leading to coronary artery disease, heart attack. Additionally, those endocrine changes cause elevations in bad cholesterol as well as decrease in good cholesterol. And ultimately, there's the potential there that due to the lack of ovulation and the lack of a monthly menstruation, an accumulation of overgrowth of endometrial tissue in the uterus, an increase in the risk of endometrial cancer. 50 to 70% of women with polycystic ovarian syndrome go undiagnosed or misdiagnosed. So when you think about this 100 million people worldwide and over half of them not being diagnosed or not being diagnosed correctly, you can see this is a major issue. Various symptoms are part of what makes polycystic ovarian syndrome what it is. Irregular cycles or the complete absence of cycles. Oftentimes the diagnostic criteria we utilize is less than 9 cycles in a 12-month period. Unwanted hair growth, whether it be on the face, the chest, the abdomen, the back. Excessive hair growth in normal places. The loss of hair growth in normal places. Androgenic alopecia, the male pattern baldness or loss of hair, which typically occurs on the crown or the bilateral temporal area, as demonstrated by one of our members. When this affects women, can be quite troubling. Acne, we see this in our young patients especially. And some of these symptoms, while we may think of them as a normal process that takes place, when occurring to extremes or at inappropriate ages, may be a red flag indicating that indeed an individual may be experiencing the effects of polycystic ovarian syndrome. One of the other things that we typically look at during examinations, and because of my training and one thing or another, I can't go through the grocery store without looking at people and saying, I think they have a thyroid disorder, I think that person might be having PCOS symptoms. But it's the changes in pigmentation that occurs, and perhaps you've seen somebody or know somebody in your family that has developed what's referred to as dark, velvety changes in the skin on the nape or the back of the neck. It often occurs in the axillary region or the inner thighs. And I'm not talking about just a good tan. I'm talking about dark, black appearing skin in those areas. And how do you treat stuff like that? Because it can be quite alarming to an individual, whether it's loss of hair, overgrowth of hair, acne, or those changes in the appearance of skin. So one of the implications of polycystic ovarian syndrome is not only the physical changes that are taking place, but the psychosocial impact. Young individuals with extreme acne certainly, is very, has a negative effect on their demeanor, on their self-confidence, as well as some of these other issues that we've talked about. It's very troubling, and we see patients frequently in our office who are complaining about, male pattern baldness in a woman, and that's very, very concerning. So, these are some real issues that have some very significant, effects on people. And as we've said before, 50 to 70% of these people are wandering through life without a correct diagnosis. And consequently, the key to treatment is understanding what you're dealing with to start with. So let's talk about diagnosis. Well, there's 3 main things that we look at. 1 is irregular or absence of menstruation. 2, hyperandrogenic changes. And what that refers to is androgen hormones having an impact on a woman so that she is developing male type characteristics, acne, and the changes in hair growth that we mentioned, as well as some other things that go along those same lines. The 3rd criteria is actually the polycystic ovaries. Now, those 3 things in combination, it takes 2 of the 3 to make the diagnosis. You don't have to have hormone levels that are proven to be increased on laboratory evaluation. Rather, you simply have to have identifiable effects of increased androgen hormones. Again, excessive hair growth, hair loss, acne. It's been said that a young girl should never have acne on her chest or her back. And if she does, she may be experiencing some of the sequelae of the PCOS syndrome. So 2 of those 3 things lead to the diagnosis of PCOS. Sometimes that diagnosis is not based upon a lab, it's not based upon an ultrasound, but rather the patient's clinical presentation. Consequently, it's not recommended to do regular ultrasounds looking for the accumulation of these cysts on the ovaries, because that's only part of what takes place. But for the purists in the crowd, the number is thought to be, if you have 12 small cysts on an ovary, that categorizes that ovary as being polycystic. By the way, you can have a polycystic ovary without having polycystic ovarian syndrome. Consequently, you can have polycystic ovarian syndrome with not having an accumulation of cysts on the ovary. Remember the other two criteria. So the diagnosis is something that takes a little bit of understanding and making, but certainly is important. The criteria, by the way, to diagnose a young lady with polycystic ovarian syndrome within the first 2 years of starting her menstrual period is unclear and not well defined. So again, I think it requires a trusting, developed relationship with your physician. Let's talk just a little bit about treatment, and then ultimately we'll move on to our conclusion for today. Treatment, there is no cure for polycystic ovarian syndrome. Rather, there's multiple things that we do to try to address each one of these factors that contributes to the negative outcomes of PCOS. So if a patient's having an overgrowth of hair, there's laser treatment, there's creams that retard the growth of hair, and ultimately the treatment focuses on changing the abnormal hormone levels that are involved in stimulating the hair growth or the hair loss, or the increase in insulin, or the increase in the blood sugar levels, or the abnormal cholesterol levels. Consequently, one of the things that we look at is what changes take place when a person has polycystic ovarian syndrome. And oftentimes it's associated with an increase of weight. Although we say weight gain doesn't cause PCOS, there seems to be a contribution there. Why? Because the insulin, again, doesn't work very well. So we develop more and more insulin, which causes an insatiable appetite. And so when we think about, well, why doesn't so-and-so just lose weight? Perhaps they have increased insulin levels, which cause them literally to feel like they are starving to death throughout the day. Let's talk about luteinizing hormone, one of the hormones that causes the ovary to ovulate. When people have PCOS, those hormone levels, along with the insulin levels, both are sky high, and that causes the ovary not to ovulate and actually causes the ovary to overproduce testosterone. Now, there's 4 different hormones that we look at when we're considering androgens, but testosterone is one. It's the one that's often referred to as causing some of these issues. Let's talk about hair loss just a minute, because it's caused by an androgenic hormone, 5-alpha reductase, and that hormone works in what's referred to as the pilosebaceous unit, which is at the presence of the base of every hair follicle that you have in your body. That's a hormone level that we cannot measure by drawing blood from your arm. But we know that that hormone works in that area to cause that hair follicle to cease hair production. And so most everybody's heard of Rogaine. That's one of the few FDA-approved treatments for stimulating hair growth. But if we can reduce the male type or the androgen hormones by lowering your blood sugars, lowering your insulin levels, causing the ovary to function on a monthly basis, then we've made some progress in treating some of those adverse outcomes. One of the simple treatments that we often use is birth control pills. Birth control pills increase the estrogen level. They increase what's referred to as sex hormone binding globulin, which binds to testosterone, thereby reducing the effects of, again, those androgenic hormones. When we look at some of those other negative sequelae, cardiovascular disease associated with a decrease in the good cholesterol, an increase in the bad cholesterol. Certainly we have medications, perhaps some of you are familiar with those, or maybe even take those, the statin medications, as well as some others that help normalize cholesterol levels. We see central obesity occurring in patients along with the acanthosis nigricans, that dark black velvety pigmentation change that takes place in response to carbohydrate intolerance. And so if we can cause or help patients get onto basically a low carb diet and help normalize some of their blood glucose levels and bring those insulin levels down as well with the use of another medication like glucophage or metformin, then we can see the reversal of some of those effects. We know that stress causes an increased level in cortisol. Probably none of you in here are under any stress, but we know that cortisol does cause, again, those androgenic changes. So long story short, in conclusion, what can we do about PCOS? It's a multifaceted problem. It has lots of symptoms, lots of issues that have to be addressed individually, and I think the effective treatment starts with a good patient-physician relationship. Healthy living, plenty of sleep at night, good diet, good exercise, using the appropriate medications to treat those conditions that we discussed, all collectively together help normalize a patient's life. And I would tell you, infertility, again, that was one of the things we touched on. PCOS being responsible for 85% of patients who have anovulatory infertility. You know, I've met patients through the years who didn't have children and they maybe, you know, had PCOS affecting that. We have some really good medications to help induce ovulation and to assist patients who are trying to get pregnant. So again, a very important part of individuals' lives and something that we feel like we can help with and contribute in a positive way. So I want to save a little bit of time for questions. I hopefully, you know, I've stimulated a little bit of thought. I would tell you in closing as well is that, you know, there's stuff about PCOS all over the internet, PCOS support websites, and we just encourage you, you know, to look at that. If you know somebody that, you know, maybe is struggling with some of these issues, you know, share with them what you heard today. Again, on our Facebook site, we've published a little blog about PCOS and in hopes that it'll help somebody.